Hey everyone, welcome back to another Intellect nursing video. In this video, we're going to go over schizophrenia. We're going to go over the pathophysiology, signs and symptoms, risk factors, complications, and the nursing management. So let's get right into it. So what is schizophrenia? So schizophrenia is a chronic mental disorder that affects the thinking abilities, and it also affects your perception, your emotions, and your behavior. And there are different types of schizophrenia, and there might be overlapping types as well. The most common one is your paranoid schizophrenia, and that includes your delusions and your hallucinations that we always think about when we think of schizophrenia. It also involves persecutory, so always accusing things, and also grandiose, so they think they are very important or have a higher hierarchy than other people. There's also disorganized, so that's a dysregulation of emotional expressions. There's catatonic, which is the disruption of movement. And there's even a residual type of schizophrenia, which includes past psychotic episodes, but they are actively still having negative signs and symptoms of schizophrenia, which we'll get into. The pathophysiology behind schizophrenia is related to dopamine and serotonin, but mainly dopamine, where there is an excessive amounts of dopamine, which is causing hallucinations, delusions, all the positive signs and symptoms of schizophrenia, which we're about to get into as well. And additionally, there is a decrease of activity in the frontal lobe controlling your emotions and your personality and your perception. And that is related to your negative signs and symptoms. And these patients might even have structural changes to their brain even. They might have less brain tissue, enlarged ventricles, and decreased levels of oxygen and glucose in the frontal lobe. But related to the neurotransmitters, these patients are more likely to have an excessive amount of dopamine and a low serotonin, creating those positive signs and symptoms and the negative signs and symptoms. Since we have already referred to them a few times, let's get right into them. So these patients have positive and negative signs and symptoms, and you're going to want to know this for your NCLEX and your nursing exams. So when you say positive, think psychosis. They both start with P. And when you say negative, think they're being negative. That is your depressive signs and symptoms. So let's start with positive. So your psychosis. Those are things such as hallucinations, delusions, disorganized thinking, or even disorganized speech. So hallucinations it could be audible, it could be visual, meaning they are seeing things or hearing things that aren't actually there. So in their reality, their perception, they are seeing something, and it may cause fear, it may cause excitement, it could be any sort of reaction emotionally, but they are seeing or hearing or feeling something that is not actually there. And then there's delusions, where they believe something that is not factually true. So they can believe, they have grandiose thoughts or delusions about themselves, for example. They might think that they are God, for example. Or they might have persecutory thoughts, like we mentioned, where they might think that the nurses or the medical staff is trying to poison them with medications. And then, of course, disorganized thinking, so they can't keep their thoughts together. Sometimes they don't go in the same direction, which makes this very difficult for them to process information that you are trying to communicate to them. And then they might have difficulty expressing their thoughts even as well. Disorganized speech. There's all kinds of different types of disorganized speech, such as echolalia, where they're repeating everything you're saying, or they say things multiple times in a row. They might have disjointed speech, where they're saying a sentence, but it's just not going in the linear direction it usually would. And sometimes they may have something called echopraxia as well. So if you make a movement, they'll copy your movement. And then there is your negative signs and symptoms. So think once again, negative as you're being negative. Those are your depressive signs and symptoms. So they might have signs and symptoms of major depression disorder, such as a flat affect, social withdrawal, apathy, lack of volition, which basically means that they cannot complete a task that they have started. These patients typically self-neglect themselves, so they don't eat, they don't sleep. And then lastly, they might have something such as anhedonia, which is the lack of ability to feel pleasure or have motivation. Or they have reduced interest in something that used to be enjoyable to them. So the risk factors associated with schizophrenia is not fully understood, but we know that, of course, family history has something to do with it, so that is possibly genetic or hereditary. It could be environmental, such as early life trauma or stress going on, substance abuse, and especially cannabis. And if you are a male, you're more likely to have schizophrenia. And the typical onset of this is usually in your teenage years to possibly up to your high 20s, but it could be diagnosed at any time in any stage of your life, but that is more likely the age range there. So what are the complications associated with schizophrenia? Well, first of all, we're always worried about the safety of these patients. So when you have positive signs and symptoms, you're hallucinating or delusional, you might do something super aggressive to yourself or to others. Of course, with depressive signs and symptoms, so your negative signs and symptoms, they may be suicidal or they might have homicidal thoughts as well. These patients have a really hard time performing their jobs, keeping a job, socializing. They're more likely to go to substance abuse or using substances. And if they're taking antipsychotics, they might have something called tardive dyskinesia, which is the inability to control their mouth from moving, and they have uncontrollable movements, which we'll get into more detail a little bit later. But these are the complications. Really just think safety, because that's really what it comes down to, is these patients are in an unsafe environment in their mind. Now, as for diagnostics, there really aren't any, but we use diagnostics to rule out other factors such as encephalopathy or any other acute conditions going on with the brain. So it could be delirium, it could be encephalopathy. We'll use labs to rule those out, so such as ammonia for your encephalopathy related to hepatic encephalopathy. They'll also do a CT head scan, of course, just to make sure there wasn't a stroke going on, make sure there's no major structural changes. For them to diagnose somebody with schizophrenia, they usually have to have symptoms for more than 1 month at least. But once again, there's nothing objectively wrong with the person typically. Once again, they might have some structural changes, but once again, there's nothing objectively wrong with the labs or any other scans that they may see. So what would be the management for these patients? Well, typically they're going to be put into a cognitive behavioral therapy, or in other words, psychotherapy. And they're usually going to be, of course, given medication, such as antipsychotics or antidepressants, to treat both the positive and the negative signs and symptoms. Antipsychotics for your positive, antidepressants for your negative. And if they have any exacerbations, such as suicidal ideation, homicidal ideation, they're just unsafe, they would be hospitalized into a psychiatric hospital. But for these patients, we're trying to improve their quality of life as much as possible and make sure they maintain safety. As a nurse at the bedside, your primary job is to make sure they are safe, and also use therapeutic communication to prevent exacerbations while they're in the hospital or while they're in the other environments. One thing specifically that the nursing exams and the NCLEX love to test about is your response to different things such as hallucinations and delusions. So how do you communicate with patients experiencing those things? So with hallucinations, you never want to validate what they see that is real. So for example, if you're in a patient's room and they say they see something or feel something or hear something that is not actually there, you don't just validate what they see. What you do is present reality in a therapeutic way and seek clarification. You want them to talk about it a little more. Once again, you don't validate it, but you help present clarity or reality to them in a therapeutic way that doesn't come off offensive. And when you are saying these types of things, you want to clarify that they are safe. Because typically when they are having these hallucinations, they feel threatened or unsafe. And you can use distractions, and not distractions that just tell them, hey, don't think about it. No, you want to give them distractions that provide joy to them. So maybe playing a game or watching something on TV, something that's not going to make them so focused on the hallucination itself. And figure out ways to help them cope with this, such as listening to music, once again, not a distraction, but something that's going to help them cope with it and understand that they are safe in their environment. Now going on to delusional statements. So when a patient says something, maybe they're grandiose and they say, hey, I am God. Well, how do you respond to that? These, once again, are going to be common questions that you get on the NCLEX and your nursing exams. So what you do here, once again, is present reality and do not agree with their delusion. So same thing with hallucinations. You want to present reality and let them know that you do not see this and they are safe in their environment. So what you want to do here is pretty similar. You want to clarify reality and you don't want to agree with it, so they continue on in believing that delusion. But it's also important to not be confrontational and just argue with the patient, of course, because then that could cause escalation. So you do want to use therapeutic communication. Don't come off and start asking questions starting with why, for example. That's a big one. You again want to use distraction techniques, coping methods that help them feel calm and safe in their environment. And using and encouraging positive self-talk is very good for delusions as well. All right, guys, that includes everything you'll need to know about schizophrenia for your nursing exams and the NCLEX. I hope this video is helpful. We look forward to seeing you in the next one.